I think everybody watching can see what an amazing panel we have here. We've had a lot of questions that came in earlier when people registered, and a lot that's come into the question and answer box. So we're going to try to get through as many of those as possible. Again, I'm also going to drop some resources in the chat box for people to see other sites that you can go to for additional vaccine information. But now I'm going to turn it over to my co-moderator, Dr. Golden, and also just want to thank her for leading COVID-19 health equity at Johns Hopkins, and also taking on mentorship of many of us who are working in this space. We're so thankful for that. Thank you so much, Dr. Golden.
No, it's my pleasure. I learn as much from people I mentor as I'm supposedly teaching them. So that's the fun part about being in this situation. But so this has been a really stimulating panel discussion. And again, just thank you all. And some questions that were answered during either Dr. Corbett's presentation or during the discussion we just had. I won't ask those of the panel, but there are 118 questions in this Q&A chat. So I am going to go through and try to group them, and I'm going to start with the ones that that were most popular. So one question is, what study is being completed to assure vaccines for children under 16?
There are several studies that are being completed to ensure vaccines for children under 16. And so the way this works is that you prove that a vaccine is safe and effective in people who are just healthy adults between the ages of 18 to 55. And then you start to go into other at-risk categories, such as the elderly, which was our second phase 1 clinical trial. And they were also included in the phase 3, as obviously Dr. Hrabowski, who was in the phase 3. And then you start to age de-escalate. And so what that means is you, in a stepwise manner, you go down in age. So you start with the 16-year-olds, and then you go down to the 12-year-olds, and then you go down into the teens further, et cetera, et cetera. And so the reason why you do this is because you need to say the vaccine was safe and effective in people that were maybe slightly healthier and more tolerant than the previous group. And Pfizer actually just finished enrolling, as of yesterday, their adolescent trial. So they will start to see some data in 12-year-olds coming out soon.
Yeah, and I was going to say, Dr. Beyrer may want to comment, but I believe in our Center for Immunization Research that one of our faculty, Dr. Talat, is actually PI on one of the pediatric vaccine trials. So I know we have some of that going on at our site. So thank you for that. So the next question, is it safe for teachers and students to return to in-person learning when they may not have all been vaccinated? And so I know like our organization has been partnering with Baltimore City Schools to vaccinate many of our Baltimore City school teachers last week, but curious about that in terms of thinking about the reopening of schools.
This is actually more of a policy question, which I have, I should say that I'm a scientist and I don't speak to policy only with the science backdrop of the policy, in that there are ways to de-risk every situation. So of course, there are ways to make it safer for children and teachers to return to the classroom regardless of vaccination status. But the safest way is that, at least for the people that vaccines have been approved for example, teachers in that 18 and up age range, for the teachers to get vaccinated. My niece recently actually started school this semester, and she's in elementary school. My mom works for the superintendent back home, and their plan is actually brilliant. I mean, they take mask breaks, they have days on, days off, they rotate the classrooms. There's only about 6 children. The children that placed up in like the 4 level in their integrated testing actually didn't have the option to come back, because you wanted to save those spaces for children who might need more help in the in-person realm. And so there are ways to de-risk anything. I de-risked my Christmas celebration, and I have 7 siblings, but we got tested, we quarantined. So de-risking is the science behind any of these so-called policy decisions. And I think as you start to see science coming out a little bit more under the new administration and otherwise, you'll start to see some of these de-risking protocols going into place. All
right, that's very, very helpful. So another question, very popular. How long before we know whether someone who has been vaccinated can still transmit COVID-19?
Yeah, those data will start to come out via what is considered to be the phase 4. So that is putting the vaccine into the general population. That was not a primary endpoint of the clinical trials. And so what that means is that it's not something that was calculated as a factor of the vaccine or the experimental groups. We've tested that type of thing or are testing that type of thing in animals right now, but obviously there is some level of you have to translate that to humans. And so we'll start to get those data coming out. What's really important is that regardless of what the animal studies say and et cetera, is that remembering what I said in my presentation, vaccination is still a community service. So we might be able to decrease transmission with the vaccine. And honestly, I would just say blanketly that I expect for that to be true. But taking the appropriate precautions around wearing masks and still considering to social distance, because you don't know who around you has what. You don't know for your particular person how much virus, even if you come into the smallest bit of contact with virus, how much just for a little bit you might be able to replicate in your upper airway that might be able to transmit. Just stay as safe as possible and allow the science to unfold and the data to kind of guide the way. And further, just allow a lot of people to get vaccinated. We're still at only about 30 million, I think, today. And so we still have a long ways to go.
Right, so it sounds like a tincture of patience. And as I told everyone, if you gave someone a new outfit for Christmas, you should have given them a matching mask because we're going to be wearing them for a long time.
I actually might, I miss public transportation. That's kind of the country girl who has now been able to live in the city. And I actually think that I probably will wear a mask on public transportation forever now. I keep saying like, wait, why weren't we doing this before? Like, there are just some situations where it makes sense, especially during flu season. And so yeah, I think that for just a little while longer, I would say that you can start to relax a little bit when you are around people who are known to be bit, but otherwise just for a little while longer.
Yes. Dr. Hrabowski, were you going to add something to that?
I was going to say, consistent with what Dr. Corbett said, we were told at the Center for Vaccine Development at the University of Maryland that even though we've been vaccinated, we should continue to wear our masks.
Yes.
Because we don't know what we can do to other people. It's just better to be conservative that way, right?
Yep.
Yes.
But it does feel good to be vaccinated. Let me just say that. It feels very good to be vaccinated.
I agree. I'm very happy about it. I'm so excited.
I get my second one on Friday. So.
Yeah.
Yes, and I've had my first, and my second one will be in about 2 weeks. So
and we just had our 96-year-old mother-in-law vaccinated. So I want people to know if the 96-year-old can do it, anybody can do it. All right.
Right. So this is a very, very common question. So can you speak to the recent announcement regarding safety for pregnant women? There have been some questions about that.
The recent announcement was a WHO announcement, which we can take that for what it is the WHO has the entire world watching them and listening to what they have to say. And so they generally take a more conservatively cautious approach to their recommendations. The current recommendation from the CDC in the United States of America, given the data that we have, and also that OBGYNs and otherwise physicians are giving to their patients, is that it is your choice and that there has been no sign of the vaccine being unsafe for pregnant women. In fact, there were about 9 people in the Moderna vaccine trial that, by way of the pandemic, got pregnant while they were in the trial, and nothing of any concern happened to those women. What the WHO is saying is that there have not been any completed specified trials in particular for pregnant women to say yes or no. And that is the level of caution that the WHO, where they sit at the top for the entire world, must use. But here we would say it is your choice, and that vaccines save lives and even save infant lives by way of passive immunity, honestly.
Mm-hmm. All right, great, thank you. And we may have touched on this earlier, but can you explain why a vaccinated person can still carry and transmit the disease? So there's the difference between, preventing the infection or the severe infection in the person who is vaccinated versus the transmission. So how is it we can still transmit the disease?
Because what is happening when you are preventing disease, as was the primary endpoint in the trial, is that you're preventing infection in mostly what is in your lower airway, which is fairly easy to do when you think about how immunity works. What's harder is that you get these specific antibody proteins up here in your mucosa, so we call it, your nose and your mouth, up here in your upper airway, that would, what we call, be sterilizing to the point of where not one viral particle can infect one cell. We do not know that yet. So what if, I'm being conservative here, but like, what if you had one viral particle get into your nose and replicate, and then you walked over and you transmitted that, whatever the daughter virions, to the next person? So that is the possibility. And we do not know how we can gauge that possibility just yet, because that was not one of the questions that we were able to ask in the phase 3. So as those studies are happening, we'll start to get those data. But for now, conservatively, you should expect that you might be able to transmit virus to someone else, although, we'll see.
All right, great, thank you. Again, importance of continuing to mask. And so this is a good question. So what's known about the rate of mask usage and social distancing among members of the two groups in the trials that we have data for?
Well, they were actually advised. Actually, Dr. Hrabowski, can you speak on how you were advised to live your life after you were vaccinated in the trial?
Sure. We went in with masks, and the idea was we'd continue to be cautious as we had been. The idea of social distancing, using the mask, washing your hands, that we needed to be as careful as we had been being all along. It was very important. The one thing I would tell in terms of building trust, it turned out that I had a blood pressure problem that I keep telling people, and they actually would not put me in the trial at first because my pressure was too high. And they had me go to my doctor first, get my pressure under control, and then I came back. And I tell you that not because I like telling my business, as they say, but it's so important for people to know, because a lot of Black people, Hispanic people have high blood pressure. They're not going to do something that's going to make things worse for you. They want to make sure you're in a certain, even with a condition, they want to make sure you're okay before they put you in the trial. And they did that before they allowed me to be in the trial, and continued to monitor everything else. So, but the key is we did continue to do the things we were doing before we had the first injection, and that is to try to be as safe as possible.
And that question comes up because people look at the data and they say, well, what if all the people who actually got the vaccine just stopped wearing their mask, or I don't know, or the placebo just stopped wearing their mask? You have 30,000 people. And the reason why you have 30,000 people, Dr. Hrabowski over there, mathematician, and me thinking I'm a biostatistician, but I'm not. The reason why you have 30,000 people is because the chance that people will act about the same across those two groups is actually very high as you get those numbers up.
Sure.
And the reason why you only see 100 and however many cases in 30,000 is because that's chance, right? So you needed 30,000 people in order to see even just 190 cases. And so the chances are that people who got placebo and people who got vaccine acted just the same in that clinical trial as those cases were occurring.
And remember, everybody with the placebo really hoping they got the vaccine too. So everybody was listening to the directions given to them by any of the centers that delivered it. We were on our best behavior, all of us.
That's a good point.
Yeah.
And it was also an international trial. So remember, different countries had different rules and expectations around masks and requirements. So that's something to keep in mind too, that in many places it's required that you wear a mask. So this is an important question. So it'd be really nice to see the vaccine side effect data stratified by race for both the initial trial and for those that are currently ongoing, and for people who are currently being vaccinated. And so, and the thought is that this would help those who are vaccine hesitant or maybe concerned, about systemic racism. So is that data readily available?
I was going to say, yes, it is. And I just don't have it on the slide. So they stratified both the safety and efficacy by race and comorbidity in the FDA package. And you know what? That's actually, I should have that on a slide. And so thank you. And then I will also, if you guys have a website, I could just send it and
Yes.
yeah.
But there was no difference, am I right?
There was absolutely no difference.
Right.
Absolutely no difference. Yes.
I think the one, this is Chris, the one slight difference was that there seemed to be a lower rate of side effects post-immunization in people over age 65.
Oh, yes.
So
Yeah,
that's
sorry.
kind of encouraging because, you know, it's basically because our immune systems are less vigorous as we age. But
I like to think we're just a little wiser somehow. I don't know.
well, that's true. That's true.
You know, the really cool thing also about this vaccine, so I always try to take it back to the data that we generated, is that in the phase 1, what came out is that the elderly people in the trial actually fared just equally as good as the younger people with their immune responses. Very, very robust immune responses, which is something that you don't necessarily see as people age. You see, for example, the flu vaccine, older people have lessened or weakened immune responses to the flu vaccine. So that's actually very, very promising, considering the fact that elderly people are more vulnerable to COVID-19 and particularly to severe COVID-19.
There is a question in our registrations that kept coming up as well, that, you know, people talk about the anti-vaccine movement in our country and how that's framed, how people think about vaccines and led to some of the hesitancy. And this can really be anyone on the panel that wants to speak to it, but how do you suggest we talk to family members or friends that are, you know, kind of anti-vax or have been a part of the anti-vaccine movement or see things on Facebook or other social media that are against vaccines?
You know, I have a soft spot, surprisingly, in my heart for people who are so-called anti-vax, because it's from where I come. It's actually those people, right? It's the people that I went to high school with. It's the people in my community, rural North Carolina, those types of people where, you know, understanding where to find your information, understanding, not knowing exactly who to trust, really putting a lot of weight on what you see online as opposed to what could be considered to be more factual ways of getting data, those kinds of things. And so I have a soft spot. And one of the things that is very clear is not residency with facts. It's not going to happen. What you have to do is you have to beat it with the soft spot, with the empathy, and almost in a very individualized way. It is, what is the thing that you believe? And not let me tell you why it's wrong, but let me tell you what is also possible. So I think that you have to really do it in that kind of way. I think it's only right? I think it's so. For anti-vax, which I actually don't even like using that term, I do prefer vaccine hesitancy. For the vaccine hesitant crowd, I think that this is the first time that a vaccine has been developed before anyone's eyes. Something about Moderna, Pfizer, somebody was on the news every single day. It's confusing. And I'm just lucky that I was able to start doing vaccine development when I was 20 years old. Before the lay person, this is the first time this is happening before their face. And so the reason why I give that type of presentation is because I want to say, let me bring you into what we did. Let me put you in my shoes just for a little bit. And that really helps. It helps in that direction, putting them in my shoes. And then also for me to step outside of what is, frankly, a very privileged position at the National Institutes of Health back into the rural Black girls' shoes. And that's what I do.
I have to tell you, she also had another Black woman on her team. I was very proud of that. She brought another one of our MDiv scholars over there who was able to get published and everything, just getting ready to go for the MD, Ph.D. So if you see her team, if people see her team, you will see that diverse team. And then on the other side, the manufacturing, we've got another UMBC graduate, the chief scientist at Moderna, Black male. Quite frankly, it's important for people to know African Americans and other people of color are part of this process, and that the scientists are people who can talk in real language to real people and be compassionate as you hear Dr. Corbett being, understanding why people feel like that. I want to commend you all for putting it out there and being honest. Yeah, there are reasons people feel like this. The Tuskegee study, the Henrietta Lacks. It's significant that Hopkins is doing all this, recognizing the challenge of the past, but saying, but what do we do now? What do we do now? The idea of having people of color as a part of the team, and then talking about the issues and why people don't trust and what we can do now. And what I finally say to my friends, many educated ones who are hesitant, is listen, what choice do we have? What choice do we have? Do we want to die? Black people are dying at much higher percentages, people of color. So what choice do we have? This is our opportunity. It's, as I said, a gift my wife and I gave ourselves, getting the vaccine.
So Dr.
Yeah,
Hrabowski, I would also say that it is our time to change up the way by which we are doing things. We are here on Zoom. Many of our people, Black and brown, do not have the opportunity to actually be able to see and hear us. So now I need to bring Queen Corbett onto the mobile and take her to the street where they can hear, see, and feel her. And this is our reality that we're living right now, because the majority of persons that are vaccine hesitant are those persons that work the streets day and night, trying to make enough dollars or trying to find a place where they can get a fresh, bath and or shower and get some food on the table and the like. And so reality is that the scientists and the advocates need to meet on Pennsylvania and Lawrence Street and really make certain that we are giving them some food and some hats and gloves, but we are allowing them to be in the presence of the one that has the mind, the heart, and has the team around her to actually say, this works. It will be okay. Yes, you will experience maybe a sore arm, a headache, terrific fatigue. I called it terrific because I got to sleep a lot that day.
I felt the same way.
Vaccine. And so that was my side effect, fatigue for 2 days. I could stay in bed. So I think that we really have to understand that we can't be in the office. We have to take it to the streets.
Right. And let me suggest, because there's so many places that need to hear that message, that what you said, Reverend Hickman, but also that need to see the face of people like all of you on the call, that I think even being creative and taking little videos out to whether to schools, so the children can see all these people, into churches, because I'm with so many, but being able to, in the churches and out on the streets, ways of showing videos of this type to show experts at Hopkins, experts at NIH, coming from UMBC and whatever, very important. Your point is well taken, because as Dr. Page said, people don't have internet service sometimes. They can't make the appointments for the vaccine. We've got to have ways of getting out into the neighborhoods to make the difference.
Yes.
Yeah, the other thing that I was going to say is that when we talk about trust, I think on one side there is the trust, but what I want to remind people is that when you don't have trust in something, you actually don't lend any reason for them to be accountable. You're not even asking for people to be accountable to you. And so it's, if you allow your spouse to walk out the door and you're like, oh, I don't even trust you. Well, why would they even do right by you at that point? What onus do they have?
Yeah.
And so what I have been suggesting to people, even if you just place that trust level, or that if you just say, at least trust me, just say you trust me. So then now there is some accountability to what I have said to you. And I actually, over Christmas, I went back and I listened to every single interview that I have done since April, and I have not said a lie yet. I have told you exactly what was going to go down. This is the timeline we're expecting. This is this, and this is that, because I am okay with that level of accountability. I'm okay with coming back and saying, okay, well, we were wrong about this, if we were ever wronger, and et cetera. And so just lending a little bit of trust establishes that now you're accountable. And when you start to get bigger and outside of just me, when you start to lend trust to an entire system, what happens if a system does a community wrong in this instance, next time or after that, there's a level of accountability that must be upheld. And so, I don't want anybody to be able to say, well, the reason why we didn't get the vaccine to Black people is because Black people wouldn't trust it. I want them to have to say, we couldn't get it there because of us, because we failed, not because they wouldn't take it. And that is the part for me. And also, as Dr. Hrabowski said, well, what else are you going to do? With the health disparity of deaths being at about 2 to 3 times now in, for example, the Black community, if we have disproportionate uptake of a vaccine, that number is only going to widen, so significantly so. And it's really what is going to maybe even be a slaughter in some communities where there's just mass amounts of unvaccinated people. And that is my fear for the next fall. And so it's really becomes this place where you just have to say, all right, I know the history. I know things are changing, and just let me listen to somebody that I might be able to trust, and somebody that has said to me, okay, I'm going to stand accountable.
Yeah.
Oh, thank you for that. That is a perfect closeout, because you've heard a lot about the science today, but then you got to look inside and say, what is your heart call reason? And for me, it was my 85-year-old parents. And so figure out who is it, or what is it that's going to tug at your heart, because that's going to be the last thing that's going to help you in your decision. So on that wonderful closing, I'm going to turn it over to my colleague, Dr. Chidinma, who is going to close us out from the Center for Health Equity.
Well, thank you so much, Dr. Golden. And I just have to say, I'm sure I'm not alone in expressing that this has truly been such a dynamic time together. And I want to begin by thanking each of the panelists for taking the time to join us in this wonderful forum. Dr. Corbett, I am trying my best to not turn this into a fangirling session. Happy birthday. We owe you a debt of gratitude in all seriousness. Thank you so much for not only just this excellent presentation that you gave about vaccines development and clarifying not just the process of developing the vaccine, but also the amount of work that has been underway for years that has helped to clarify how previous coronaviruses have been tackled. We regard you as a trustworthy person and a trustworthy source. And we thank you for answering the questions so comprehensively. We also thank your colleagues for the monumental life-saving work that you all have done. I also want to thank Drs. Hrabowski and Page, as well as Reverend Hickman, for shining a light on the fundamental root causes of COVID-19 disparities, but also for championing the role of vaccine uptake and really doing this in the context of social justice in our communities and the importance of reaching out and addressing some of these factors that contribute to vaccine hesitancy. Also, thank you, Dr. Beyrer, Golden, and Irvin, for kicking things off for us and for moderating such a great panel discussion. I wanted to begin these remarks with gratitude because when you think about the realities that confront us at this time, it's very sobering. It was just in December of 2019 that we started to hear about this perplexing disease that we now refer to as COVID-19. And in the ensuing months, we've really witnessed an unfathomable amount of suffering across the world. The Johns Hopkins Coronavirus Resource Center's COVID-19 map reports that as of today, there have been nearly 100,300,000 cases around the world, with close to 2,600,000 deaths. And here in the United States, the number of people who have died is approaching 430,000. People who are loved and whose absence is immeasurable. And when we think about all of the things that we've witnessed over this pandemic period, it's not just the staggering loss of life that's hurt us. We've also experienced economic disruption, mental health challenges, loneliness, unchecked physical ailments. And we've seen how this novel coronavirus has exploited various fissures in our society, which Dr. Page spoke about so eloquently. And even things like the politicization of mask wearing. We've also witnessed the disproportionate amount of suffering that has been borne on the backs of marginalized and minoritized communities. And all of this is occurring against this backdrop of misinformation and lies about the COVID-19 vaccines. But at the same time, I think this forum really reinforces the hope that I have for the days to come, that thanks to Dr. Corbett and her team and a cadre of dedicated scientists, we have vaccines that have been approved for use and more on the way. And these vaccines bring this hope that we will return to some sense of normalcy in the days to come. But when we think about what we're doing right now and what is facing us presently, this gathering is a reminder of just affirming the importance of accurate information and doing so, as Dr. Corbett said, with empathy in an effort to support one another and ultimately to champion a community-centered way of doing and being. All of the issues that COVID-19 has surfaced belong to all of us, and that means that it's going to require the full complement of our strengths and our talents and brain power to solve them. A lot of that solution is going to come from honoring the questions and concerns that people have about vaccines and then disseminating accurate information. So again, I want to thank you all for joining us and to charge all of us to really center accurate, scientifically founded information in the work that we're doing and making sure that we're disseminating this information in an empathic manner, that we can channel the grief that we have felt over the loss of life and the loss of quality of life into a commitment to support one another during this challenging time. So thank you all so much for joining us. I think this is the first of many conversations to come. I hope that Dr. Corbett will not be a stranger to us here at Hopkins and to the broader Baltimore community. And again, thank you all very much for being a part of this forum. And I wish you all a wonderful rest of your week.
Great. Great.
Thanks so much.
Thank you.
Thank you. Keep hope
Thank you
alive.
all.
Keep hope alive.
Yes, yes,
That was amazing.
yes.
Yep.
Walk
Wear
with-
those
Thank
masks.
you so much. We are so grateful.